Hello, Mary C. House parents. This is Dr. Cat. I've been wanting to do this for a while, and I figured I would. This was probably a better time than not, since you've been hearing the term MTSS a lot in emails from the district as well as myself. MTSS is just basically an educational acronym that stands for Multi-Tiered System of Supports. It just means that the schools use a system that they have in place for students to support them whenever there is a need in various areas. It could be academic, social, emotional, behavioral, and even the executive functioning piece, to name just a few. All students are screened to address the behavior, okay, and social and emotional, even though that's not there, as well as the academic needs. So it goes far beyond academic. Again, as I said earlier, it is a framework that we use. Again, it's an educational acronym. We understand the parents may need to have this explained to them multiple times. We get it. So never, ever hesitate to ask questions if you're confused or don't understand the process. All I can tell you that is if you are a parent now, you most likely did not experience this as a student in any school system you went through. So it is very, very different than how we went to school. The goal is to provide supports as needed versus that wait to fail model. So that's why we do not retain as much anymore. That is why we don't wait until grades are poor or students are falling really far behind before we do anything about it. We have universal screeners that teachers usually go over with you during the year, and especially at conferences. We use that as a baseline to see where all students are according to the grade level they are in, as compared to the benchmarks for the different academic areas as an example, along with behavior, social, and emotional. We want to provide those targeted interventions to meet those students' individual needs. And the goal is also to reduce any unnecessary identifications and labeling of students, because in education, the research found many, many years ago that we were moving too fast through this process and evaluating students and over-identifying students to have specific learning disabilities when in fact they just needed more specific intervention at the school level. So what is MTSS and how do we work through it here in the school? We have what's called Tier 1. You can see there, that is just basically your core instruction. That is what your child's classroom teacher is giving you in the classroom. And they are giving you instruction in reading, writing, math, the behavior, the social, emotional, and executive functioning. And we have various benchmarks and conversations around what is that benchmark and where students are falling and what do they need. Please also note that this is also for students who may be achieving above and beyond some of these. So we constantly want to meet students where they are and take them further. Obviously, the basic goal is for them to reach minimal, the grade level expectations, but we don't want to stop there with students who may be achieving above and beyond. If a student is not making adequate progress in the core curriculum, so again, what is the teacher delivering in the classroom? Then what we do is we look to target interventions at what we call in schools a Tier 2. We look at, the frequency at which we might do something, the intensity or the duration. We look at the actual materials, the programming we might do, the environment, whether it's continuing in the classroom or whether they need to come out for some small group work or even one-on-one. Just some examples of this would be academic support, social skills group. We have mentors, reteaching and repetition of some of the social and behavior and academic skills in the classroom. We also have teachers beyond your child's homeroom teacher who might be able to do some of this reteaching and repetition. Targeted interventions can happen in your child's regular classroom, okay? And we also might take them out of the classroom, of course you would know that, to target some instruction, maybe in a smaller group. But again, it can happen right in the classroom, and it can be done with your child's regular homeroom teacher. We monitor this progress by creating a goal in some cases. For example, if your child has reading support, the reading teacher has goals they want your child to meet in a certain period of time. We usually monitor this progress over a period of 8 to 10 weeks before we go back and revisit it as a team. And by a team, I mean myself, the guidance counselor, reading support, EL teacher, and our instructional coach, and your child's teacher all sit down and we review at least 3 data points when we're assessing how effective the intervention was. If they are making progress, we may just continue with that goal and that intervention as needed. If they are really succeeding in closing that gap or have closed it, we may say they are no longer in need of the intervention. If, of course, they are not making progress, we look to see if we need to change the intensity, duration, or frequency, as mentioned on the previous slide, of that intervention. If they are not making progress, we would move them to a tier 3. This is where we would give them more intensive and individualized instruction. So they would continue to have the tier 2 interventions, but we would look at something in addition, again, targeted to the goal and continuing with that tier 2 instruction. For example, and you can read right there the examples of things that we look at, but more specifically, if your child's getting reading support 4 times a week for 20 minutes, and we just find that they're not making as much progress as we would like, we may give them an additional reading time with a reading specialist or even within the classroom for a couple times a week and really, really zero in on that goal. Let's say they're working on fluency or decoding or comprehension. We really specifically target that goal and work more intensely with your child. That chart right there, again, is an educational visual for you. Basically, it's tier 1. You can see all students get that universal instruction in any one of those areas down below. Usually that's 80 to 85% of the students we have found over the years that usually succeed and meet the benchmarks or come close to it in the tier 1. In the tier 2, it's usually 10 to 15% that need maybe something in addition to the regular classroom instruction. And then, of course, we have the tier 3, which is about 5% or less of students who need the more intense interventions. If, again, now we've gone through this process, if they still aren't making the progress. Now, let me just, a side note, all students always make progress. They really do. They never completely not make progress or regress. It's just at the rate. We're looking at the rate at which they're making this progress, as we do not want them to fall too far behind before we have to take the necessary next steps. If we get through all of those tiers and we just don't have anything else to exhaust here in the schools as far as personnel, time, programs, the actual materials, then we might be looking at something in the way the child learns. That is when we would discuss with you as the parents. Again, you've been in the discussion and you know what's been going on this whole time. But this is where we would sit down as a team and say, we may want to consider permission to evaluate. An evaluation is a timely process. It takes about 60 days to complete. And at that point, we are looking for the possibility of identifying your child who might have a need because they have a specific disability. And on the left-hand side, you see there are the classifications by the federal government that we can have as listed disability. Most students qualify under specific learning disability, which again can be oral, listening, written, basic reading, and everything else under there. Why do we do this? We want to give the child every opportunity they can before we look within the child. When we look within the child, we get the cognitive, we get the academic achievement, we get the processing, the memory. We pull a lot out of that child to find out where their strengths are. Every child has strengths, and that would help us target more specifically an area of strength. It also helps us identify their areas of need a little bit more precise. So again, when we get to this point, with your permission, we would ask for permission to evaluate. If your child qualifies after a multidisciplinary evaluation for a disability and are in need of what we call specifically designed instruction, which would be accommodations or modifications, those two things, it's a two-pronged approach, disability and in need of accommodations, then they would qualify for what's called an IEP, an individual education plan. And that's when we would draft an IEP and invite you to a meeting and begin that process. Again, if you have any questions, please let us know. This was, I'm going to keep this less than 10 minutes, hopefully. Hopefully this provides you an overview. What you see in front of you as far as accommodations and modifications, accommodations we can do at any time. Some of you may have a child with a 504. You'll see accommodations listed on that as well. Basically, in a nutshell, accommodations are something that levels the playing field. For example, if your child has difficulty seeing the front of the room, we would move them to the front. We would not keep their desk in the back. So they're not getting an advantage over any other child. We're just what we call leveling the playing field. Modification is when we get together as a team and decide to modify based on the student's ability, the expectations. So we may reduce or change the learning expectations in the curriculum. We cannot do that unless we meet as a team along with you as the parent. So again, this was a brief overview, but since you've been hearing MTSS so often, I thought it'd be a good idea to share this with you. If you have any questions, don't hesitate to reach out to your child's teacher or to Dr. Cat or anybody else in the building. Thank you.